Hi guys. It's a beautiful day. So you see, I'm trying my best to bring you the best of everything. So today I happen to bump into someone beautiful. It's just unfortunate I don't want to edit anything. I told her it's uncensored. We are not editing, we are not taking any part out. So I have to bring her into the video immediately. But for you out there, you know, on my channel, we don't try to bring any big, huge medical terms and stuff like that. We just do it real, keep it, on a low tone, and then bring you the best outcome. So today I have a beautiful woman with me here. She's going to tell you everything. And after that, we get into something much more, you know, medical. So, how are you?
I'm fine.
All right. I'm also fine. You didn't ask me.
Sorry, I'm okay. I'll just think of introducing myself before I ask you. Hi, my name is Pam. I live in England, in Sheffield. I'm a mental health nurse. I've just met this gentleman doctor on holiday in Egypt, and we're doing this.
Yeah, we're doing this.
We're doing this.
Okay.
It might help somebody
Yeah, yeah, yeah,
else. I just want to tell you a little bit about myself.
Okay.
Um, am I
Nice.
fat?
Yes, of course.
Oh my God, that was so horrible. I need to lose weight. I need to eat healthy. I need
We're going deeper.
to look after myself. Reason being, I'm African and I'm prone. Africans got the prevalence of diabetes, especially to black people, black women, African women.
Mhm.
I'm type 2
Yeah.
diabetic.
Okay.
I'm on metformin 500 mg. However, I was telling the doctor today that I'm not eating well. I need
It
to
seems
figure
it
it
seems
out.
it seems like she wants us to get deeper already because not eating well just brings us to the topic diabetes, isn't it?
Yes.
Okay, but she already said she's type 2 diabetes and all that. Look, guys, take 1 second, subscribe to the channel. It's always a robust lifestyle with Dr. Ologo. You know me, I'm Dr. Samuel Ologo, and a certified board member of the Ghana Health Association. Right. So let's get deeper into it. So, diabetes, what do you understand by that before, you got into it and all that?
I think the doctor will explain. I'm just a mental health nurse.
Okay.
But however, I know diabetes tempers with my insulin
Okay.
and I need to manage it by
Yes.
taking metformin.
Okay.
However, I am not good in doing that. And I've been trying, doctor, to use alternative like taking different teas to try,
Okay.
and I don't know whether it works or not. But
Okay.
you might help me before I go and use
Okay.
insulin injections. That's one thing I'm trying to avoid.
Yes,
I
you
need to
need to.
keep myself healthy.
Because if it gets that bad, you might have to be introduced to insulin and then the oral hypoglycemic medication, which
Yeah.
I don't think we need that now. So let's get into it. All right,
Mm,
guys, let me do it this way. Okay, so diabetes is actually high amount of blood glucose, all right, or blood in the high amount of glucose in the blood.
mm,
So with this information, it means that whatever we take in ends up in our blood, but we need the pancreas, which has insulin, to secrete the insulin to take up all the glucose, some into stores, some out of the blood, and then get out of the body system. Now, everybody needs glucose. Everybody, irrespective of who you are, whether vegetarian, whatever you think of, you need glucose. And the glucose is seen to be the ATP. When we say ATP, the energy building block of the body. So everybody needs it. Actually, if you had slept and without any food or energy, you would definitely go into hypoglycemia, which is low blood glucose, and
mm.
you might not be able to wake up. In my country, we call something in kitten. That is, you've gotten hypoglycemia, and then you are getting dizzy, sweating, palpitation, a whole lot of things. All right, which is bad.
Mm.
So what are some of the things you have experienced if, let's say, your blood glucose level is either high or low?
I think I'll talk about yesterday. Yesterday
Okay.
I had a severe headache
Hmm.
and my neck was paining.
Hmm.
because I hadn't taken my medication and I had left my medication in England.
You
I,
did?
yes, I did. I
No,
forgot.
I think she doesn't like taking her medications. That is
So,
why.
however, I went next door. There's a pharmacy down.
Okay.
I went and bought the metformin,
Okay.
and I took it, and I felt better.
Okay.
I feel dizzy when it's high.
Yeah.
I feel dizzy. I have a headache. I feel I come balanced
Yeah.
somehow. That's how.
Yeah.
Those are the symptoms I have personally when
Yeah.
I'm my.
So that is basically true. So whenever someone is experiencing high blood glucose, we are much more scared with hypo because it can kill easily
Mm,
than the high. But the high, if you don't manage immediately, tends to something else. Now, some of the things you are going to see is easy fatigue, malaise. You are
mm,
going to have dizziness.
mm-hmm.
Yeah, there's going to be blur vision.
Yeah,
There
yeah, yeah.
are some P's I will
Mm,
mention. We
mm.
call the polyuria. You'll be urinating very fast
Constantly,
or
yeah.
constantly.
That's
Yes.
what I've been doing.
Oh my God. So it means when we sit in a van to
Mm,
go all the way. Yesterday I was in Cairo. Yeah.
I wouldn't
You
go there.
wouldn't go. It's a six
Mm,
hours journey, but with different stops. And so it took us into 7 hours and stuff like that. So imagine she was on a van like that. She was going to stop the driver every point of the time just to take a pee. All right. The number
mm.
one. So it's quite difficult. And then polyphagia is eating a lot of things. You get
Yes,
hungry quickly
quickly. Yes,
and then you have to eat a lot of things.
constantly eating.
Yes,
That's why
because
I'm big, like you say.
she's not big, she's just got some muscles on. So yeah, because the insulin is constantly requesting for something. Yeah, you know the pancreas has secreted the insulin. It
Mm,
requires a particular number of glucose to take out, but because your body has the insulin or your pancreas has adapted to high amount of glucose, immediately there's not much, you need to hop onto something else. That's why you see, if you don't want to grow fat or big, we advise that you get some biscuits or just something with a little bit of sugar to
mm,
munch on in between meals, not heavy things. All right. So we are doing the management as part of the tutorials. So going on, you'd realize you might need a lot of glucose to compensate the insulin. All right. Now going further, we also have you get thirsty quickly.
quickly, yeah.
You want to drink a lot of water
Mm,
because whatever you take in will come out, and that is it. Poly so polyphagia, polydipsia,
mm-hmm.
yes, and then polyuria. These are the three first things, and then the easy fatigue, the blur vision, and other things comes in.
Doctor, can I stop you and ask you a
Yes, stop here.
question?
Yeah, let's go.
However, what I've noticed these days is does diabetes affect your kidneys?
So
Because
this
I'm seeing swelling on my feet.
we are getting there. We are getting there. So let's move into a little bit more deeper. So you see, with the pancreas, these are the organs of the body that they actually need to be maintained well. The heart, the brain, the kidney, the pancreas, the liver. Now, anything that happens to you systematic, if I say systematically, it means it goes through the blood and then
Mm,
throughout the entire body. You will see some of the significant effects in the feet. When you have diabetes, there is going to be we call it compression, all
mm,
right, of the lower extremities, and this is because this is because um, the the blood circulation is also being tempered, all right, and that will worry. Um, it have an effect on the kidney. It have an effect on the liver. It has an effect on all the systems, on your eye. I know if you've gone to the hospital to check some of these things, they will tell. I'm not trying to make you panic,
yeah,
but for education's sake, when you get to the hospital, they might want to do even a fundoscopy to check if there is no diabetic retinopathy.
they've done that. I've read that down.
So diabetic nephropathy will lead to swelling of the legs because the nephrons, that's the kidney. Back to your question, the kidneys are being affected, the nephron, the filtration unit of the body is being affected. All right. So you need to, the water is good, but you need to make sure you are taking in what will help you adequately. You need to manage the blood glucose in order not to get to higher levels, because there is diabetic ketoacidosis, there is hyperosmolarity, hyperglycemic,
Mhm.
um, HHS. Guys,
Don't
no
worry about
medical
that.
terms.
But
Yes.
the question is, how does metformin support a patient with diabetes? Because what through my research, I have realized that they're saying it's they're suggesting it's not good to take metformin because it doesn't do nothing.
Uh,
No, I know.
okay.
And then from coming from an African
Mhm,
background,
mhm,
and we don't use metformin in Africa most of the time. We have natural herbs or anything
mhm,
to use,
mhm,
and people are surviving. Unlike people in England, 'cause being a nurse, I have seen people struggling, having
mhm.
sores, treating people with horrible, horrible
Diabetic
diabetic
faults,
fault, diabetic
a
sores.
whole lot.
Unlike at home, you can find people with diabetes but functioning to their full.
I'll tell you something.
Yeah.
Let me check something and then tell you.
Mm.
All right, it's there. So, guys, whatever she's saying is very true, but it's just a tinge of the fact. This is it. You see, taking in metformin or whichever hypoglycemic drug, which means any medicine that is supposed to suppress the blood glucose level, is the best.
Okay.
When you take metformin, there are actually two things that you need to get out there. It's either the pancreas is not producing insulin at all, or the pancreas produces insulin but is not sensitive to take out glucose.
Okay.
Now, you are taking metformin because your pancreas is working, it's producing insulin, but it's not sensitive to take out glucose. If you weren't taking metformin, you'll be taking in insulin because your pancreas is not working, and it requires you to take out. You need an external insulin to take out the glucose. That is why in type 1 we inject them the insulin itself, and in type 2 you take in medicine because there is insulin, just that it's not able to pick up. It's
Mm-hmm.
not able to pick up. Now, back to where we come from. You see, I barely want to say this sometimes. We don't take care of ourselves. There's a platform I don't want to go deeper into.
No,
We don't take care.
I'll raise
Yeah,
my hand up
yeah,
because I know I'm diabetic
yeah,
and I know I have to change my lifestyle.
yeah.
However,
So
our food,
yeah,
our African food,
I want to
yeah,
hit on one thing there. You see, it's not just our African foods are the best.
rice.
Yes, I'll tell you why.
Mm,
So the fact is, we have all the green leaves. We have all of them. Think of it. If you go to the northern part of our various countries, you'd realize the food they eat is super. You take it, there is emptying of your bowel
mm,
easily. I mean, you take it, you feel strong, and all these things, they are there. The, the point is, we are eating a lot of junk now, and it doesn't mean eating those fried stuffs, and I don't mean to say that, but it means that the right amount, the right nutritional quality, and all these things we don't pay attention. I was in China for 6 years, and when you look at a Chinese person's table,
mm,
you find about 14 different dishes per meal at a sitting. And the reason is there is small amount of rice in one bowl, small amount of orange in one bowl, small amount of whichever salad you can
mm.
think of. I mean, salad is a mixture. So there is carrot, there is cabbage, there is cucumber, there is all on the table. By the time this person leaves, you know you are satisfied but not full. And that is what we have to learn.
Mm.
Yes, but we are not. We want
You
to, at a certain, we want to,
finish and get full.
we want to dissect and interpret the meaning of. I'll
Like,
be going there soon.
yeah, I'm saying that's what I did.
To
I
fetch
mean, to
everything.
finish everything.
Yes.
I was telling my sister last night,
Mm.
I was so uncomfortable full.
Yes.
Not that I couldn't stop eating, but I
It's
kept
available.
eating. It
It's
wasn't
available.
available.
It's
And
available.
yeah,
So we and so back to that same question. We don't check up, go for checkups.
mm,
Like going to check whether you have diabetes or not.
mm,
Working in my country, I realize people come in the worst state of
diabetes.
diabetes, and you would have to automatically, you can't do anything, just chop off
Chop
the
the
leg,
leg. Mm,
chop the finger, do something, do something. But here, people go for checkups, people know what they are battling, and so the questions keep on coming.
mm-hmm,
Yeah, and those questions, as a doctor, a GP or something, you need to answer them for the person.
mm-hmm.
If you don't answer them, the person won't leave. So these are things we need to adapt, or else we are not going anywhere.
True,
Yes.
true, true.
Let's manage this condition, diabetes.
Mm-hmm,
Yes.
yeah.
So in the first place, I've mentioned that we have the type 1, type 2, where if you are type 1, you need basically the insulin because your pancreas is not producing at all. And the type 2, you need the medications.
Mm-hmm.
If you see your doctor, it's not just metformin. There are different forms of medication that even helps to lose weight
Hey,
whilst treating
Ozempic.
not just Ozempic.
I'm looking for Ozempic that I prescribe.
Yeah, not just Ozempic. They are actually a class of medication. You know,
Mm,
I don't really like mentioning medication because I want you to deal with your doctor. I give you the information, you go to your doctor, you ask questions, your doctor will help you out. So most of these things, there are medications in treating diabetes. And if you are, trust me, if you are religious about your medication, it will shock you or you marvel to know that your blood glucose will move from whatever high level into normal ranges.
Okay, can I ask you about the
Yeah,
ranges?
yeah.
Mostly in the morning when I wake up, let's say I try it, maybe I'm on 5. Is that normal?
It's about 5.
Yeah.
That's okay.
And then when I eat, it's about 8. And
So from where we are coming from, here they use different digits, okay,
mm-hmm,
the numbers. But from where we are coming from, if you are within up to 7,
mm-hmm,
if you're on fasting, you've not eaten, like you slept, you woke
yeah,
up, no food, you just check up to
right,
7,
yeah.
you are good.
Okay,
When you've eaten,
can I start with
yeah,
the, if I'm taking my metformin in the morning and
uh-huh,
I'm 7, should I continue taking
you
it?
have to continue taking it. One thing about
I want to clear
medications,
that.
yeah,
Yeah.
medications for diabetes and hypertension is that you must always take your medication until you've been taken off of it and then replaced by what we call the dash therapy, using dietary and vegetables to manage or control your diabetes and hypertension. Yes, if trust me, if you are doing 5 and 7, it means that you can control it. But if you should get a dietitian or a nutritionist to give you a plan, one plan that you are going to use for about a month
Mm-hmm.
or 2 or 3 months, you call me back and tell me it worked.
I've been referred to a dietitian.
So you have to go,
Mm,
please. Don't
okay.
miss it.
Yeah.
Go tell the dietitian all these problems. That is lifestyle modification. That's the first management principle. So lifestyle modification. If you are able to go, I don't want to talk about exercise because we don't like it, but it's
It's good.
good. You have to exercise.
Doctor, I ran 5K. I don't know. I ran 5Ks every
I,
morning.
I missed it.
I said it. I ran
I
5Ks every
missed it.
morning. I do run.
You do?
Yeah, 5K every morning before I go to work.
Give me that.
Oh, when I'm working nights,
Mm.
I go to the gym on my break. Of course, I've got 1 hour, 30 minutes.
So
I'm not like proper, but I do.
I think
Mm.
you are the best now. Yeah, you are the best now. So she's doing
Mm.
five, five,
5Ks.
5K.
Mm.
Okay, so that's good. That's super, super good. So for you like this, if you are
Mm.
even using, I won't mention the drug. If you are using one drug you mentioned,
Mm.
you will get very good outcome. Very, very good out. I'll tell you after this.
Yeah.
Yeah, I don't want to mention drugs here
Mm.
because she's doing 5K And then if she gets the dietitian to get her into a good, meal plan, she's going to ace everything. All right, you are going to ace it with lifestyle modification and then being on your medication. Yeah, it's going to be classic. Trust me, guys. So, the complications are outrageous. I don't want to go there. We have their names are attached to diabetes. So, diabetic nephropathy, diabetic, it just comes as it is. If you don't take time, your leg may be chopped off. You have to be careful. I'll do a different video. Oh, not you.
No, I know, but I get scared because
Yeah.
guys, I'm just looking at him like this because I'm a nurse, I know better,
Yeah.
but I am not taking care of myself.
Yeah.
So being here and being open about it is a difficult thing. However, I am listening to the doctor.
Yeah. So we want to prevent the complications. There is blindness. There is the foot being taken off. A whole lot of complications. I wouldn't want to go
Doctor,
there.
can I go in?
Go in.
I am seeing, that's what, I don't know, what do you call it?
Diabetic retinopathy. Is it blur vision?
Yeah, like black things sometimes.
So when there is halos,
Halos.
yes, please, guys, you need to check yourself. I'm begging you. This is real life experiences given us. We are just honored to get some of these informations like that because it's not out there. People are teaching, yes, and people are learning, but the real thing, you need to get hold of it. So the first thing I told you, you need to change your lifestyle.
Yes, I will.
Now you know it's discipline. One thing that is very difficult to actually come out there to say discipline. If you want to really do it, I don't wake up to do 5K. I
do.
don't. But if you are doing it, it means you can control the diet.
Yeah.
You know, look, you can eat anything. One thing I need to advise you guys on, you can eat anything you want to eat. Anything, irrespective of being diabetic or hypertensive. Ask me why. Let me answer.
Why? Carbohydrates.
Yes. Now let me show you guys. If you are taking the right amount, do you think when you go to the dietitian, she will ask you to stop taking flour? She won't. Because you need glucose from the flour. You don't just get glucose from green leaves or fruits. Do you get me?
But however, you can get carbohydrates from those.
Yes, you can. But so what I'm trying to say is, whatever you are eating, if the quantity, the moderation is manageable, your body will pick it up. Imagine you are taking. Have you been to the Chinese restaurant there?
No, not yet.
Oh, you should book, and then you come out angry because have you eaten in a Chinese restaurant before?
Not really.
Not really. Okay, so they are.
I do takeaways.
Okay. Oh, so they are
Sorry, guys.
they are
There's
so
stock back. They're eating other people's food.
so
Just let me show you.
let's
Just a
show you.
bit. It's eating other people's food.
It's blown off.
Sorry.
No worries.
We just spoke like,
Okay,
oh, sorry,
let's go.
guys.
Let's go.
We're back.
We're back on track. So if you are eating whatever you want, but in moderation, the right amount, the right volume, the right amount of nutrients, you don't have any problem.
Okay.
Do you get it? So go to your dietitian. She gives you the plan. You hit it. You do your
Gym and
running.
everything. Yeah.
You hit it, and then you take your medication, please,
I will do that.
until your doctor says stop. If your doctor says stop, you can stop that.
Okay.
Do you get it?
Yeah.
What do you have to tell the family out there?
Please do the right thing.
Yeah.
Take care of yourself because regretting later is not a good thing. You got families to look after. You got somebody will have to look after you.
Yeah.
And I know it's not in a nice way to be looked after.
It's not.
So if we take care of ourselves from the word go and listen to our doctors and try and take the step that they're giving us, I am one of the people today. Next time when you see me with the doctor, I will tell you my readings will be much better. Thank you very much.
Guys, thank you. Please subscribe to the channel. It's Dr. Samuel Ologo, and I'm a board certified doctor from Ghana.